Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Point 9 Hormonal Imbalance Symptoms. Hormones are chemical messengers that affect many body processes, such as sexual function, reproduction, metabolism, and mood. You can develop an imbalance due to natural hormonal transitions or certain medical conditions. This can lead to a variety of symptoms such as menstrual irregularities, skin changes, and weight fluctuations. /r/n/r/n This article addresses hormonal imbalance symptoms, what causes them, and how to get them back in balance. /r/n/r/nJena Ardell Getty Imagesrnrn Hormonal imbalance can lead to menstrual symptoms such as /r/n/r/n. In addition to breastfeeding, pregnancy, and menopause, other conditions that can disrupt hormones related to menstruation include /r/n/r/n. In this article, female/women and male/men refer to people with the typical reproductive organs of cisgender females and males. Verywell Health recognizes that some people who identify as women or men do not have the same anatomy as described in this article. When research or a health authority is cited, the terms for sex or gender from the source are used. /r/n/r/n. Skin symptoms caused by hormonal imbalance include /r/n/r/n. Glands throughout your body make over 50 different hormones. Many of these hormones respond to fluctuations in other hormones to maintain stability. A hormonal imbalance is when you have too little or too much of one or more hormones. Even a small imbalance can lead to big changes. /r/n/r/n. Hormonal imbalance digestive symptoms may include /r/n/r/n. Sex hormones help regulate the gastrointestinal (GI) tract. Estrogen and progesterone in particular may influence irritable bowel syndrome (IBS). GI symptom changes related to the menstrual cycle are common. /r/n/r/n. When estrogen levels drop during perimenopause, so do serotonin levels. Serotonin is a chemical messenger, neurotransmitter, that helps brain and nervous system cells communicate. A drop in estrogen can also happen postpartum. These changes can result in symptoms such as /r/n/r/n. Other hormonal conditions, such as overactive thyroid, hypothyroidism, can also cause mood symptoms. /r/n/r/n. Weight changes are sometimes the result of a hormonal imbalance. For example, hormone changes due to menopause or having too much cortisol, as in Cushing's syndrome, can result in weight gain. Conditions such as hypothyroidism can lead to weight loss. /r/n/r/n. Hormones have a big impact on the hair growth cycle and hair follicle structure. Anything that affects your hormone levels can affect your hair, causing /r/n/r/n. Hormonal imbalance. Sleep symptoms can include /r/n/r/n. Poor sleep can make it 10 times more likely that you'll develop depression. While hormonal imbalances can cause sleep problems, it's also true that sleep problems can upset hormonal rhythms. /r/n/r/n. Low sexual desire can be a symptom of a hormonal imbalance. /r/n/r/n. Endocrine, hormonal, abnormalities are common in people with sexual dysfunction. Several hormones, primarily testosterone, can affect the male sex drive. Estradiol, testosterone, and progesterone all help modulate sexual desire in females. /r/n/r/n. Other sex symptoms include /r/n/r/n. Infertility is defined as not being able to conceive after 12 months of regular sex without birth control. /r/n/r/n. Conception depends on ovulation, release of an egg from an ovary. Ovulation depends on the timing of certain hormones, such as gonadotropin-releasing hormone, GnRH, luteinizing hormone, LH, and follicle-stimulating hormone, FSH. Infrequent or irregular periods could mean that you're not ovulating. /r/n/r/n It's rare, but hormonal imbalance due to low LH and FSH levels can cause fertility symptoms in males. /r/n/r/n Certain medications can also cause changes to hormone levels. Some of these are /r/n/r/n hormones can get out of balance due to natural transitions in life, such as puberty, pregnancy, and menopause. Many medical conditions also affect hormones. That's why it's important to see a healthcare provider and find the cause. Your specific symptoms and clinical examination will determine the next steps. /r/n/r/n hormone blood tests may include /r/n/r/n treatment depends on the specific diagnosis. /r/n/r/n For example, low estrogen and low progesterone in females can be treated with hormone replacement therapy, HRT. HRT is typically used to treat menopausal symptoms. There are many ways to take it, including tablets, patches, and gels. It's not for everyone, though. It may not be safe if you've had certain conditions, such as /r/n/r/n hypothyroidism. Treatment usually involves taking synthetic hormones to substitute for those your thyroid can no longer make. Any underlying conditions, such as diabetes, must be treated as well. /r/n/r/n treatment for PCOS and some other conditions may require more than one type of therapy. In addition to balancing hormones, there are therapies to address particular symptoms. /r/n/r/n You might be able to affect hormone levels through diet. Certain plants contain compounds that mimic estrogen. Foods that may help boost estrogen include /r/n/r/n Vitamins B and D can help boost estrogen, and a mineral called boron can help the body absorb estrogen and testosterone. If you're considering taking dietary supplements, it's a good idea to speak with a healthcare provider first. /r/n/r/n Other natural ways to keep hormones in balance include /r/n/r/n symptoms such as unexplained weight changes, menstrual irregularities, and skin problems may be related to hormonal imbalance. Natural changes, such as puberty, pregnancy, and menopause, can cause dramatic hormonal changes, as can medical conditions, such as thyroid problems and PCOS. /r/n/r/n hormonal imbalance is treatable, so it's important to see a healthcare provider for diagnosis. Blood tests can usually determine if your levels are within the normal range. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.